So good day everyone, I'm Betty Mayu Hernandez, first year college from BSN1D. So now we're going to put the oxygen with our patient. But first, we need to assess to our clients the thorax and lungs, skin and mucous membrane color, breathing patterns, chest movements, lung sounds, presence of clinical signs of hypoxemia, presence of clinical signs of hypercarbia, presence of clinical signs of oxygen toxicity. Now we need to determine the vital signs, laboratory results, oxygen saturation. Okay, now we need to assemble the equipments and supplies. First, with the cannula. First, we need the oxygen supply with flow meter and adapter. Okay, next the humidifier with distilled water or tap water according to agency, the nasal cannula and tubing, a tape optional, and padding for the elastic band. Next, for the face mask, we need the oxygen supply with a flow meter and adapter, humidifier with distilled water or tap water according to agency protocol. Next is to prescribe face mask of the appropriate size. Next is the padding for the elastic band. For the face tent, oxygen supply with a flow meter and adapter, humidifier with distilled water or tap water according to agency. Next is the face tent for the appropriate size. For the preparation, we need to determine for the oxygen therapy and verify the order for the therapy. We need to perform a respiratory assessment to develop baseline if not already available. Next, we need to prepare the client support people. We need to assist the clients to semi-Fowler's positions if possible. So the rationale of this is positions permits easier chest expansion and hence easier breathing. Okay, now we need to proceed in the procedure. Okay, for the first procedure, we need to explain, we need to introduce ourselves to our patient and verify his or her name. So, good day sir, I'm Betty, your student nurse for today. May I ask what is your name? Okay, how old are you na po? Okay. So, next we need to explain to our client what we're going to do and why it is necessary and how he or she can cooperate. So, good day sir, for today I'm going to put you the oxygen. So, the oxygen is not dangerous when safety precautions are observed, and now we need to sir, is that okay to you to put the cannula? Okay, so after the explaining, now we will proceed in the wash hands and observe other infection control procedure. So the rationale of this is for the patient to avoid the spreading of microorganisms or the cross-contaminations among patients or clients or vice versa. Okay, so for the next, we need to provide for client privacy. For example, we need to close the door or close the curtains. Now, we need to set up the equipments and the humidifier. First, we need to attach the flow meter to the wall outlet or tank. Okay, so the flow meter should be in the off positions if needed. Now we need to fill the humidifier bottle. So this can be done before coming to the bedside. Next, we need to attach the humidifier bottle to the base of the flow meter. Next, we need to attach the prescribed oxygen tubing and deliver device to humidifier. Next, we need to so for the adult client should be sitting unless observed specified. Both feet should be flat on the floor. The elbow should be slightly flexed with the palm of the hand facing up, the forearm supported at heart level, And lastly, we need to expose the upper lower arm of the patient. So next, we need to turn on the oxygen at the prescribed rate and ensure proper functioning. Okay, so next we need to check the oxygen is flowing freely through the tubing, and there should be no kinks in the tubing, and the connection should be airtight. There should be bubbles in the humidifier as the oxygen flows through. You should fill the oxygen at the outlets of the cannula, mask, or the face stand. Next, set the oxygen at the flow rate order. Okay, now we need to apply the appropriate oxygen delivery device. First is for the cannula. Put the cannula over the client's face with the outlets prongs fitting into the nares and the tubing hook around the ears. If the cannula will not stay in place, tape it to the sides of the face, pad tubing, and band over the ears and check cheekbones as needed. So now we will put the cannula with our patient. Okay, so ma'am, lalagyan ko na po ito. Okay, so after putting the cannula, for the face mask, we need to guide the mask toward the client's face and apply it from the nose downward. Fit the mask to the contours of the client's face. So the rationale of this, the mask should mold to the face so that very little oxygen escapes into the eyes or around the cheeks and chin. Next, we need to secure the elastic band around the client's head so that the mask is comfortable but snug. Next, the band behind the ears and over bony prominences. So the rationale of this, padding will prevent irritation from the mask. For the face tent, apply the tent over the client's face and secures the ties around the bed. Next, we need to assess the client regularly, assess the client's vital signs, level of anxiety, color, and ease of respirations, and provide support while the client adjusts the device. Some clients may complain of claustrophobia. Next, we need to assess the clients in 15 to 30 minutes depending on the client's condition and regularly thereafter. Next, we need to assess the clients regularly for clinical signs of hypoxia, tachycardia, confusion, dyspnea, restlessness, and cyanosis. Next, we need to review the oxygen saturation or arterial blood gas result if they are available. Okay, for the nasal cannula, assess the client's nerve for encrustations and irritation. Apply water-soluble lubricant as required to soothe the mucous membranes. Next, we need to assess the top of the client's ear for any signs of irritation from the cannula tubing. And if present, padding with a gauze pad and may help relieve with the discomfort. So, ma'am, are you comfortable with the cannula tubing? Okay. So, do you feel any irritation? Okay. Now, for the face mask or tent, inspect the facial skin frequently for dampness or chapping and dry and treat it as needed. For the next, we need to inspect the equipment on a regular basis. First, check the liter flow and the level of water in the humidifier in 30 minutes and whenever providing care to the client. Next, we need to be sure that water is not collecting independent loops of the tubing. And then we make sure that the safety precautions are being followed. So after all the procedure, inputting the oxygen and checking all the stops with the patient, we need to document findings in the client record using forms or checklists supplemented by the narrative notes when appropriate. Okay, so ma'am, for the last time, do you feel any pain or irritation? No. Are you comfortable at all?
Yes.
Okay, so after that, we need to do the hand hygiene again. Okay, So that's how I demonstrate to you the oxygen administration with our patient.